we're going to talk about Chapter 8. These are drugs that affect the GI system. You have to have that basic understanding of anatomy and physiology of the GI system to understand what's controlling the GI system, know the difference between the vomiting, regurgitation, small and large bowel diarrhea, and then understand what drugs induce vomiting and those that inhibit it. We're going to talk about anti-ulcer medications, also how does diarrhea work and the medications we can control it with. We talk about laxatives, GI prokinetics and stimulants, also digestive enzymes, antibiotics, and anti-inflammatories. These are the key terms that you need to know about with this chapter: adsorbent, anticholinergic chemoreceptor trigger zone, cholinergic dentifrice, emesis, hematemesis, melena, motilin, parietal cell, peristalsis, regurgitation, segmentation. These are all in your key terms vocabulary dictionary at the start of your eLearn course. So what are the problems we see with GI tract? Regurgitation, vomiting, diarrhea, weight loss, colic, bloat, flatulence, abnormal stools, and constipation. You need to be able to understand the difference between these problems, what is causing them, how to control them without making other problems worse. Anatomy, there are differences between the GI systems of a lot of different animal species, and we've gone over that in anatomy and physiology. It's greater than any other organ system that we talk about. Functions are basically the same in each species, though. It's the intake of food and fluid into the body, absorption of nutrients and fluid, and the excretion of waste products. Here are the three major GI systems that we talk about. The monogastric system, that is typical in a carnivore or an omnivore. So it looks a lot like our GI system, where we have one stomach, a duodenum, a pancreas, a jejunum, the ileum, the cecum, and the colon. This is large bowel. This is small bowel. We also have the liver and the gallbladder attached to it. With the rumen, this is all the same down here, except with the stomachs, we have it pouching out into four different stomachs. We have the rumen, the reticulum, the omasum, and the abomasum, and that's the order in which the food goes through it. It starts in the rumen, is fermented there, goes back up into the stomach, and is chewed into a bolus and drops back into the reticulum, goes from the reticulum to the omasum, from the omasum to the abomasum. In the bird, we have the esophagus coming down to the crop, going into the proventriculus or the stomach, the gizzard, then the duodenum with the pancreas, the jejunum, the ileum, the large intestine with a rectum, and ending in the cloaca, which also receives from the urinary system and the reproductive tract. So understanding the physiology, what are the chief functions? Intake solid and liquid nutritional substances, absorb and utilize chemical substrates, energy and tissue repair and support, expel waste, conserve water, digest nutritional substances into their chemical substrates. So stomach has HCl. This is stimulated by histamines. In the duodenum, we have bile from the liver, gallbladder, and amylase and lipase from the pancreas. So we need to understand how these things are happening. Vomiting and diarrhea are probably our most frequent complaints. They're commonly linked together in clinical presentations, so if an animal is vomiting, often it follows that they have diarrhea as well. This is stimulation of the sympathetic nervous system. Some emesis is when we vomit. So the mechanism is, first we'll see increased salivation. So if you see an animal that is hypersalivating, chances are pretty good they're going to vomit next. Increased GI motility, the wrong way, and a decreased tone of the esophageal sphincter. Vomiting is initiated by activation of the vomiting or emetic center in the medulla of the brain. And this vomiting center is connected by nerve pathways to the chemoreceptor trigger zone, or CRTZ, the cerebral cortex and peripheral receptors in the pharynx, that gag reflex, GI tract, urinary system, and heart. Impulses can be generated by pain, excitement, or fear in the cortex, disturbances of the inner ear with CRTZ, drugs such as apomorphine and digoxin, which work on the CRTZ, metabolic conditions such as uremia, azotemia, ketonemia, endotoxemia, and that all works on the CRTZ, and irritation of those peripheral receptors. An example would be like the gag reflex in the pharynx or in the stomach. If you're introducing hydrogen peroxide, creating lots of bubbles, that could irritate the peripheral receptors and cause vomiting. Here's an example of the brain showing pain, fear, and motion. So motion sickness is felt here. Drugs and toxins can affect this chemoreceptor trigger zone, and then irritants feedback from the pharynx, larynx, and stomach to the chemoreceptor trigger zone. Diseases, changes in electrolytes, etc., feedback to the vomiting center and the chemoreceptor trigger zone. So when we're inducing or treating emesis, either way, we need to prevent dehydration or water loss. We also need to prevent electrolyte imbalances, loss of chloride specifically. Chloride is what is lost with vomiting. And then we also need to prevent the loss of hydrogen. It's also alkalosis is the loss of hydrogen. It goes along with the loss of chloride. What's in the stomach? Hydrochloric acid, right? So we can use things like electrolytes, Gatorade. Usually don't use that orally. We'll put it into them IV. First thing that you're going to do is dietary management, okay? Dietary indiscretion is the most common cause. They're eating something they should not. So what are we going to tell clients? So the first thing is NPO, nothing in the mouth for how long? Depends on the size, age, species, breed of the pet. If it's a rabbit, 30 minutes is a long time. If it's a puppy, 6 to 12 hours can be a long time. If it's an older dog or cat, 18 to 24 hours is pretty typical. If they have pancreatitis, it could be as long as 3 days, right? Then, if they've stopped vomiting and diarrhea, we can start giving them small amounts, make sure they can keep it down. Want to increase, we're going to decrease the protein a little bit, increase the carbohydrates a little bit. Emetics are drugs that induce vomiting. Emetics are administered to animals that have ingested toxins most commonly, and they remove about 80% of the stomach contents. Animals need to be monitored closely for signs of toxicity after induced vomiting and watch for aspiration. These work on this CRTZ, and that is apomorphine, xylazine, and hydromorphone. Okay, this is an opioid. This is an alpha-2 adrenergic agonist, and this is also an opioid, apomorphine. So uses in apomorphine: dogs. It can produce protracted vomiting, restlessness, and depression. With cats, they do better with xylazine. Hydromorphone can be either dogs or cats. Both of these cause sedation. These are centrally acting. Locally acting would be syrup of ipecac and hydrogen peroxide. So they're going to irritate the gastric mucosa and send this syrup of ipecac also stimulates the CRTZ. So the irritation is going to go directly to the vomiting center. Also here, vomiting center. Okay, it's not going to stimulate the CRTZ. Syrup of ipecac can cause some cardiotoxicity, lacrimation, which is tearing, and salivation. So vomiting center, primarily with our locally acting emetics. Here's a disease, EPI. It's a German Shepherd, very thin, probably eating just fine, has large voluminous stools. Common in German Shepherds, EPI is exocrine pancreatic insufficiency. So the pancreas is not able to produce dietary enzymes. What do? We supplement them with pancreazyme, Epidog, whatever. Food hypersensitivity. This is a local allergic reaction. It just happens to be local through the GI tract. So it can affect the entire GI tract or just a portion of it. be vomiting and diarrhea. Could be vomiting, could be diarrhea, could be large bowel, could be small bowel. Inflammatory bowel disease is when we have that local allergic reaction throughout the intestinal tract. And again, it can be stomach and small intestine versus large intestine. How do we diagnose it? A biopsy. Often, before we do a biopsy, we'll do some dietary management and try a novel protein first. What is a novel protein? It's a protein that is new to the animal they've never had in their system before. Probably the most novel protein that our animals get would be kangaroo. Okay, and there is a diet specifically with kangaroo in it. But also we can use hydrolyzed proteins that are broken down so they don't look like proteins anymore, and our body can use them without having to try to manage them. Food allergy is a systemic allergic reaction, meaning that they are eating it and it causes allergic reaction not just with their intestinal tract, but throughout their whole body. So often we see this as a skin issue. Usually need to do a food trial with a novel protein. The average time period to tell if the trial is effective or not, meaning they only get this protein in their mouth, nothing else in the mouth but this protein and water, is 8 weeks. 8 to 12 to tell whether it's effective or not. People often give antiemetics, things that stop the vomiting. This is a symptomatic treatment. It's not necessarily going to correct the underlying cause of vomiting. In most cases of vomiting are self-limiting, or they're controlled by withholding food or water for 24 to 48 hours. We don't always have to use an antiemetic. Phenothiazines are all antiemetics. Acepromazine, prochlorperazine, chlorpromazine. They act by blocking dopamine receptors in the sympathetic nervous system, so they're going to block the sympathetic nervous system. Okay, there's centrally acting antiemetic, works at the brainstem. They can have sedative side effects and lower the seizure threshold. Their side effects are hypotension and sedation. So we see vasodilation, those ace eyes that we see, those red droopy eyes that we see is common. Meclizine or Antivert, it's most effective in dogs and cats when vomiting is a result of a motion sickness, or diphenhydramine, chlorpheniramine, and dimenhydrate. This is Dramamine. These are over the counter, and these are all antihistamines. It depresses the vestibular input. It causes dry mouth or sedation as side effects. And with cats, diphenhydramine can cause them to be overexcited. It also will make them froth horribly at the mouth because it's very bitter tasting to cats. So either meclizine as the prescription or over-the-counter products like Benadryl, chlortrimeton, or Dramamine. These are all antihistamines that work with motion sickness. Procainamide derivatives like metoclopramide. Metoclopramide we've seen as something that is in the sympathetic nervous system drugs, but we're calling it a procainamide derivative. It is injectable form, syrup or tablet. It is a direct-acting cholinergic. It regulates and strengthens the gastric contractions, decreases pyloric tone, stops the mechanical part of vomiting, and it's contraindicated if your animal has a foreign object. Anticholinergics, antispasmodics. Atropine can have action on the CNS, so we have to be careful of that. Centrine is aminopentamide, propanthyline, and methylscopolamine. These are all anticholinergics that we talked about earlier. Their method of action are to decrease GI spasms, intestinal motility, and intestinal secretions. The drugs may cause vomiting. It's an antiemetic, but it could cause vomiting if we don't have if the stomach is not emptied before we give it, and we may have to add other antiemetics when we use it. On to diarrhea. There's small bowel diarrhea and large bowel diarrhea, and you need to know the difference between the two. With small bowel diarrhea, it's also often caused by a flaccid bowel, so it gets really, doesn't like to move very well. It can be caused by enteritis, which is inflammation of the intestinal tract. Often what we see are voluminous feces, so a large amount of bowel movement. When they have it, it's just a large amount in a puddle. With large bowel diarrhea, we'll see colitis, which is inflammation of the colon. We'll see a small amount of feces, a constant need to go, is mucousy and bloody, frank blood in the feces, often caused by whipworms. With diarrhea, any type of diarrhea, what we're seeing are increased fluid secretions, and this can result from the actions of bacterial endotoxins from microorganisms like E. coli, Clostridium perfringens, Clostridium difficile, Campylobacter jejuni, and Helicobacter. So increased fluid secretions or decreased absorption of fluid because we have an inflamed intestinal tract. Also altered motility. If we're not moving things through appropriately, we're going to have some changes as well. So, or if we're moving things by too quickly, there's not enough time to reabsorb the water. So remember your fecal scoring so you can determine if we're at the stage where we're starting to see some diarrhea. Okay. Some antidiarrheal agents that you can use. Narcotics, like butorphanol, will increase segmental contractions but decrease intestinal secretions and enhance intestinal absorption. They decrease GI motility, and this can cause ileus, which is where we have a stoppage, or constipation. We have a stoppage of the intestinal tract. And we have to be very, very careful if we have a bacterial induced infection that's causing the diarrhea. That bacteria can release toxins, and if we are slowing the GI tract and not allowing things to move out of the system, then those toxins can build up and become very dangerous. So we want to be very careful when we're using antidiarrheal agents that we've actually allowed them to have diarrhea for a few days to get all the bad stuff out, and then maybe see if we can figure out what's causing this before we stop it. Using protectants and absorbents can be really helpful to treat the symptomatic effects of diarrhea because they will absorb the fluid and bind the bacteria and the toxins and provide a protectant coating to inflamed intestinal mucosal areas. So they're not going to allow that stuff to build up in the GI tract and cause more problems. We do have to be cautious when we're using cats, giving these protectants and absorbents with cats, because these protectants like kaopectate, Pepto-Bismol often have aspirin as a metabolic byproduct, so that can become toxic, reach toxic levels in cats very quickly. And also with x-rays, because they often have radio-dense material like barium and other heavy metals in them that can interfere with our x-rays. If we're not expecting a contrast x-ray, we're not going to want to give it. So some general GI agents or antacids we can use. Mineral antacids like Maalox, Tums, or milk of magnesium often have aluminum, magnesium, or calcium that are combined with hydroxides or carbonates. These neutralize gastric acid and inactivate pepsin. In ruminants, antacids such as magnesium hydroxide are used to treat rumen acidosis. So it controls vomiting and diarrhea, can be given every 2 to 4 hours. It's useful with chronic gastritis, reflux, esophagitis, and ulcers. It can interfere with tetracycline because tetracycline has to do with calcium, as does digoxin and cimetidine. It increases magnesium and interferes with calcium function, so we can see CNS depression, bradycardia, hypotension, and cardiac arrest. H2 receptor antagonists. These are antihistamines, but these antihistamines work in the stomach versus at the CRTZ or the vomiting center. So these H2 receptor antagonists are cimetidine or Tagamet, ranitidine or Zantac, and famotidine or Pepcid AC. These are antihistamines that respond to histamine by blocking gastric acid secretions, and they're a competitive antagonist to histamine in the stomach. They do all the things that we see here. We don't see a lot of side effects, but cimetidine can cause problems in the liver, so it alters the metabolism of the drugs. So cimetidine is a medication that you will see that interacts with other drugs quite frequently. So often we see these H2 antagonists associated with omeprazole, which is a proton pump inhibitor antacid, not a mineral antacid, not a histamine receptor antagonist. This proton pump inhibitor binds irreversibly at the secretory surface of the parietal cell to the enzyme sodium potassium ATPase. When it's bound that way, the enzyme is inactivated and the cell is unable to secrete acid until a new enzyme is synthesized. So it inhibits that proton pump. It helps with gastric or duodenal ulcers and also esophagitis. We do have to be careful of constipation, sedation, ileus, pancreatitis, and CNS side effects. Misoprostol is another antacid that's really a prostaglandin E1 analog. So it directly inhibits the parietal cell from secreting H plus hydrogen ions into the stomach. So this is the prostaglandin that is important to keep the acid levels at a safe level to protect the mucus lining of the gastric mucosa and increase the mucus and bicarb production in the stomach. So it prevents or treats gastric ulcers, especially those that are associated with NSAIDs, because NSAIDs block prostaglandins. So that if we can supplement prostaglandins, we can decrease that effect. Some side effects we can see: diarrhea, vomiting, flatulence, and abdominal pain. Laxatives. We might use laxatives to loosen bowel contents, encourage evacuation. We might, if we call it if it's a strong or harsh, or purgative, meaning it's just really rushing things through that intestinal system. The categories are saline and hyperosmotics, bulk producing agents, and lubricants. Saline and hyperosmotics contain magnesium or phosphate anions. They are poorly absorbed in the GI tract, which means they stay inside the GI tract and are not absorbed through the body. What they do are grab water and soften the stool, and that increased water helps to stimulate stretch receptors to enhance peristalsis. Some examples would be lactulose, magnesium hydroxide, magnesium sulfate, which is Epsom salts, and sodium phosphate salts, which is a fleet enema. And this helps with constipation. We can see cramping, nausea, and if we overuse it, it will cause an electrolyte imbalancing, especially in cats. Bulk producing agents are indigestible plant materials, and these absorb water and stimulate peristalsis as well. Metamucil, psyllium, and bran. We can see the relief of constipation in some types of impaction. Can see some cramping, nausea with that. Lubricants like oils or hydrocarbon derivatives can help to soften the fecal mass and make it easier to move through the GI. We can use mineral oil or petrolatum. Laxatone or cat lax is something very often used for constipation in cats, and that's what it can help with. We do have to be careful because there are hydrocarbon in here. If they vomit and aspirate it, that we can never get that out of the lungs, so that can be a danger. There are also surfactants or stool softeners that reduce surface tension and allow water to penetrate the GI contents to soften it. These may also increase GI secretions. These are Colase, Surfac, and DSSS, disposable and Enema, so docusate calcium, docusate sodium. If we have hard, dry feces in small animals or impaction in horses, digestive upset in cattle, we can give these things. Orally, or we can do an enema. Now, I do have. If you click on this, this will go to should go directly to an enema YouTube video, but you can watch that on your own. Some irritants that we can use to irritate the gut wall and stimulate peristalsis would be Dulcolax or castor oil, and this helps with the treatment of constipation and ileus. We seldom use this in vet med, but it is something that can be used in order to get things moving again. We do find that when we do an exploratory surgery to try to figure out what's going on with an animal, just doing the surgery itself stimulates peristalsis. So often, if an animal is really suffering from vomiting and diarrhea, and we go into surgery because we think there might be a foreign body or something in there, if we go into surgery, just playing with the intestines itself will irritate it enough to cause peristalsis and make things work better. Some drugs that increase motility of parts of the GI tract, like laxatives, antiemetics, and ileus, these are called prokinetics and stimulants. Dopaminergic antagonists. Oh my gosh, there's metoclopramide again. We just saw it used as a procainamide. We just said it was a procainamide. We also said that it was a cholinergic, direct-acting cholinergic drug. So there's a lot of different ways that we can categorize metoclopramide. What does it do? It stimulates the motility of the gastroesophageal sphincter, stomach, and small intestine, but it stops there. So it's not going to create diarrhea. It's just going to get things moving to the back part of the intestines. We use it for gastroesophageal reflux, or GERD, and delayed gastric emptying as an antiemetic. We can see some behavioral changes, and we have to worry about intussusception. Stopping the intestines like a foreign object, it will cause intussusception, and that can be very dangerous. Serotonergic drugs like cisapride stimulates the motility of the proximal and distal gastrointestinal tract, including the gastroesophageal sphincter, stomach, small intestine, and the colon. This helps with cats in the treatment of constipation, gastroesophageal reflux, GI stasis. It is not an antiemetic. It just gets things moving toward the distal end. It can cause diarrhea and abdominal pain. Motulin drugs, this is like erythromycin, which is actually an antibiotic. It mimics the effect of the hormone motulin in upper GI at low doses. It increases gastric emptying, decreases the transit time, so it makes things move through the intestines faster, which we can see with this anorexia, vomiting, diarrhea, and abdominal pain. Direct cholinergics. So, there's metoclopramide again. See, it's a direct-acting cholinergic. Also, dexpanthenol increases parasympathetic tone. We will use this for post-op ileus and colic, but it can cause cramping and diarrhea. Acetylcholinesterase inhibitors, or H2 receptor agonists. These increase the amount of acetylcholine available to bind to smooth muscle receptors, and it promotes gastric emptying to decrease vomiting. Can lead to the side effects of nausea, vomiting, diarrhea, drooling, sweating, lacrimation, bradycardia, and various others. Anything that is like is a cholinergic. Okay, so this would include neostigmine and ranitidine. Metronidazole is an antibiotic. Okay, so these are all antibiotics used primarily in the GI tract. This is a synthetic, so lab-made antibacterial and antiprotozoal agent. It also has anti-inflammatory properties. It treats giardia, enteritis, ulcerative colitis, hepatic encephalopathy, and an anaerobic infection in dogs. Giardia and anaerobic infection in cats, and treatment of anaerobic infection in horses. It should not be given to debilitated pregnant or nursing animals. It can cause anorexia, hepatotoxia, neutropenia, vomiting, and diarrhea. I've actually even seen a dog with an aptitude for seizing have some seizure disorder with this as well. So metronidazole is actually one of my go-tos for GI disease with diarrhea. Lincosamides, this is Tylan or Tylosin. This is a macrolide antibiotic, and we use it for the treatment of chronic colitis, so chronic straining bacteria. Sulfonamides, they're sulfa antibiotics. It's also antiprotozoal. We'll treat it for bacterial infections and coccidia. We don't see a lot of side effects, but usually if we do, it's after a long time use. Anytime we give an antibiotic, we want to give a probiotic. Even if we're not giving an antibiotic, give a probiotic if you're seeing diarrhea. It actually decreases the severity and the duration of the diarrhea. Also, super B vitamin can help with absorption and digestion and stimulate the appetite, so it's another adjunct medication to give in GI disease. Some anti-inflammatory agents that we use in the treatment of inflammatory bowel disease can decrease the accumulation of white cells in the intestinal walls, so it makes it much easier for nutrition to go through it. So most treatment options involve hypoallergenic diets and anti-inflammatory agents. Starting with prednisone, which is a common corticosteroid, we want to use it sparingly because there are a lot of side effects, including GI upset from gastric ulcers. Azathioprine is a purine antagonist antimetabolite that's used in the treatment of inflammatory bowel disease because it's immunosuppressive. Sulfasalazine is converted by intestinal bacteria to a sulfa drug, and aspirin. So we have to be very, very careful not using aspirin. So it's antibacterial and anti-inflammatory. Ulfasalazine we use in dogs with chronic colitis that can't tolerate sulfasalazine. And then metronidazole, antibacterial, antiprotozoal, anti-inflammatory. Some other GI drugs we'll use with different pets would be the anti-foaming, bloat guard, etc. If we have an animal with a frothy bloat, that means there are a lot of little bubbles in the rumen. When we have a lot of little bubbles, it's tough to get that gas out of the rumen. So what we want to do is, it's a surfactant that will reduce the surface tension, break the bubbles, and allow that gas to come out of the bubbles, and then we can take that gas out of the rumen. Very rare to have any side effects from that. If we need to use a medication for weight loss, Durlotapide is a microsomal triglyceride transfer protein inhibitor that blocks the assembly and release of lipoprotein in dogs, but it can cause vomiting, diarrhea, lethargy, anorexia, constipation, and dehydration. Very rare that we would actually use this medication. Probiotics. I cannot stress enough the importance of giving probiotics when you have a GI tract issue, especially with diarrhea, inflammatory bowel disease, food allergy, or if you're giving antibiotics. Any antibiotics for anything. Fortiflora, Culturelle, GI conditioner, there are a lot of different probiotics available. You do want to give one that is species specific because each of the different species have different good microbes that work in our systems. Probiotics speed up recovery time by about 25 to 33%. Appetite stimulants are sometimes needed if our GI system isn't working because we're not eating. Then it's not going to do well. So diazepam is a good one, alprazolam, those are both benzodiazepine, and then ciproheptadine. Ciproheptadine is actually an antihistamine, so it's going to decrease the histamine release, so it's going to make the animal feel better and also stimulate the appetite. Some other oral products that are part of the GI because they're dental products. Dentifrice and cleansing products would be toothpaste, gels, foods, and chews that have enzymes or chlorhex to break down and prevent plaque. There are also human products as well. We do have to be careful with human products, especially toothpaste, because they tend to have too much bicarb in them and too much fluoride in them. And the thing is, when we spit our toothpaste out, don't swallow, but animals don't do that. They'll swallow the toothpaste, and too much fluoride will make them sick to their stomach. Fluoride products come in gels or foams or sprays. Typically, when we're using them, we're rinsing the mouth out afterwards after a dental cleaning. Periosteutic agents. Doxyrobe is placed in the periodontal pocket after dental cleansing in the use of a cannula to scrape out anything in the periodontal pocket. Upon contact with a watery environment or aqueous environment, the product coagulates and releases doxycycline for several weeks. So it actually has a matrix on which the bone can rebuild and reduce that periodontal pocket. So it kills bacteria in that space and allows bone growth. A bioactive ceramic agent called Consul-Dental. It's a substance used to promote the regeneration of bone lost as the result of periodontal disease or after tooth extraction. Polishing paste, we usually use CET prophy paste, and then disclosing solution is something we can use if an animal looks like it has perfectly clean teeth. We use this disclosing solution to show the presence of plaque. If you have any questions about the GI drugs, please write them down and we'll discuss them in class.